one of the most important things I really like to do is to not have it just be purely trying to extend your wrist. I very much like it to be tied to something that is really motivating. Like for instance, for me, one of the most motivating things in the world would be being able to pick up a cup of coffee, right? So I would try to work on decomposing all of the tasks associated with trying to complete this one goal of being able to pick up a cup of coffee.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Hello.
How are you?
Fine, thank you.
I'm so well. Thank you so much for asking.
Okay.
I heard you were doing reps over there a second ago. I heard you were counting out loud. What were you counting?
What were you counting, Daddy?
I was doing balancing exercise.
So
Excellent.
The way the caregiver, he would ask him to stay up front, and he's a very tall guy, so he would show numbers.
Okay.
So he has to stand straight and not hold to anywhere, and tell him what the numbers he's showing with his fingers.
Mm.
That means he had to lift the head up and not just, because most of the time the way he's walking is tilting his head down.
Yeah.
So that's the way. He's very tall. So he'll be forced to kind of look a little bit up to be able to say what number is it that he's showing with his fingers.
Yeah, that's a really good technique. That's a good one. Because actually, balance is so important, not only about like our sensory motor functions, but it's also our vestibular systems in our inner ears that help us generate balance. So that's really good. You guys are working on that too.
Yeah, he's pretty good, and we're grateful that we can come and spend time here with my dad. So that's been working out pretty well.
Very good.
Yeah.
Well, good. And Paris, too, how are you doing? Are you how's your work? I know you're also quite a busy person. So
yeah. Oh, it's going fine. I mean, this week is it's a better week compared to last week. So
okay.
But yeah, busy. We're still working from home, which gives me some flexibility. We have to hear and see what the plans are. I work for the government, so I have to see what their plans are in terms of reopening and how would that look like.
Sure.
So yeah, I mean,
sure.
So far so good.
Good. Well, excellent, guys. Well, let's see what we can get out of the rest of the session today. So,
Sure.
You guys, last time we chatted, we were talking about the Motus foot, going
Sure.
through some troubleshooting there as well. So that's good. You can go ahead and close this for right now.
Oh, close.
So let's go see exactly where we are in terms of movements right now. Let's see how we are.
Is this position fine for the hand?
Yeah, I think so. I think relatively far up. That's okay. It can help kind of also keep the line of sight in a good fashion. So that's good.
Okay. And also, I don't recall if we set up the mentor. Well, maybe not the hand mentor, but we did the games for the foot.
Yes. I believe we did change it, but remind me of those that we wanted to make modifications of.
Yeah, definitely the strongman. And you said you have, at least for the foot, I know we had two strongmans. One is just for one direction, the other one is both.
Yep.
We don't want the thermometer. It's a little bit counterintuitive for him.
Okay, off.
With the Plinko is fine. The Symphony something is good too. The Cosmic Tennis is good too.
Okay.
Motus Chef.
Okay.
And Motus Pet. And also the Brick Breaker.
And Brick Breaker. How about the card games? We have solitaire.
No,
Get rid of
well,
solitaire. Okay.
no, but he likes the Motus pets that was further down.
Right here. Yep. Okay. Great. Slot machine, not so much.
Yeah, no, that's fine.
Okay.
And he likes that too. He likes
Okay.
to win money. Sorry, I'm just setting the alarm. Turning it off.
Okay. There we go. So those are updated.
Wonderful.
So let's go through, guys. Yeah, let's actually go through and yeah, we'll go to main menu. And we'll go to assessment real quick here. Let's see where we were. Did you guys just recently get the this Motus Hand back in?
Well, we had an issue
Okay.
a couple weeks ago, and we had to get a new device.
Okay. Because I wasn't seeing anything. The last time I'm seeing data is on the 20th. Does that sound about right? Just because of the that delay in getting
20th of
yeah.
August?
Yes.
Now it should be further back.
Okay.
Yeah, definitely further back. A couple weeks
okay.
ago, they sent out a new device.
Sure. So when was the last time you guys actually used it then?
Oh, my dad uses it every day.
Okay.
Yeah, he does it.
Let me go.
Part of his routine every morning, he does at least half an hour, and then in the evening, he does another half an hour.
Okay. Okay. I could just have to pull down a new report, so I will do that momentarily.
Okay.
Let me go and do that now. So take this a second here. Okay, but in the meantime, let's go ahead and get to our assessment then. Okay. Beautiful. Go ahead and clear that. Okay. So we'll just check just to make sure we're in the right. There we go. Perfect. So we are connected now. This is good. Okay, so first things first, guys, let's just go ahead and get some range of motion measures here. So just relax, and we'll do this a little bit differently today.
Okay.
Very good. Some quick responses there. How you guys doing? Is it okay so far?
Is it okay? No pain? It's fine.
Perfect.
Yeah.
That moved a lot quicker than before, I would say.
Okay.
That is good. So the reason I'm surprised by this is that's it takes a lot less force to get up into extension than before.
What does that mean? There's less tone?
Yeah, so yeah, basically. So it could be one of two things. It could be either the muscles has less tone or there's less sort of activity. Because tone is a combination of the physical structures being potentially more tight, but also the activity, right? If there's more activity, those muscles could be tighter, like electrically. So there's kind of like the passive side and the active side of tone that you have to consider. Hard to uncouple them without necessarily getting EMG reads on things, but
okay.
In either way, it's good, really good. Did you guys get Botox recently, or are we kind of in transition period?
I told you that he was going to participate in a study, and we haven't heard from his doctor that when is that going to happen?
Okay.
For kind of just it's for the past year we've been hearing, oh, it's gonna be next week, but it kind of fades away. So
yeah.
no, he
it's always 1 week away, and it's 1 week away for a year, right?
But so
Yeah.
this gentleman who is here, he's a professional stretcher. So he's doing a lot of stretches with that. So that
Good.
could be a good one. And
Yeah.
you know, he does a lot more stretches at home, and you know, does his exercises and routines as
Good.
well.
Good. Yeah. And then, of course, you know, if you guys are using the Motus Hand every single day, all this is going to help contribute to a larger range of motion capacity. Yeah. Yeah.
Every day for at least 1 hour.
Good. Okay. Well, let's do our next step here. Let's go ahead and get you to move as much as you can for me. So let's see if we can go as far up as you can.
What was that again? Sorry.
Try to go up and down as far as we can. So we'll go down as far as we can.
Go as down as far as you can, Dad.
Yep. As far down as you can go.
So try.
Great.
Please.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
Keep going. Keep going.
Squeeze one. Charlotte does.
Good. There you go. Good, 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 good.
Further. Take your time.
Can you go to 14? Minus 14. There we go. There we go. Good. Very good. Okay, and relax. Take a big breath for me. Big relax.
Nafas. Take a deep breath.
Okay, I'm gonna put in some assistance there. Just relax there. Good. Now what I'd like you to do is try to go up as far as you can into extension. As far up as you can go.
Try.
As far up as you can go. Good. Good. So see those numbers, they're slowly creeping up. Can we go to 43.6, 43.7? Keep going. 40. Can we go to 44? Can we go to 44? Go to 44. Go to 44. Come on. Come on. Yes. Yes, we got it. Beautiful. Good. Okay. Good, good, good. Let's go down a little bit here.
Does he need to push down, or you're doing it?
No, I'm just gonna do this real quick. I'm trying to see where we are. Okay. Okay. Good. Now let's try to go up here again for me. As far as you can go up. Move up as far as you can go. Up, 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 up. Go to 39. It's a little bit harder there. Okay. Good. So I think I've got my numbers here that we need.
Okay.
Okay. Pretty happy with this. So couple of changes here for sure. Let's look at where we were before. So I'm going to go ahead and give us a rest. Let's go look at where we were. Oh, you're right. Yeah, it was just me. I just needed to take a new update on our data here. So you were exactly right. We did have data come in yesterday and today, so we are good to go there. So big thing is, on terms of extension, we were hitting like 36s, but we were actually, you can see we're kind of hitting reasonable like 36s, but we're trending down in terms of flexion. That means we're getting more and more flexion there. It's a bit noisy, and that's okay. But there's kind of a trend coming down into more flexion. Now, The thing that's really interesting actually is we just hit larger numbers into extension. And so I think we need to actually, like today, we were hitting 46s, so 10 degrees more. So I think we need to up those values. And actually, wait a second, he hit 50, 51, and that was only at about 80% assistance. But we were hitting really good numbers at like, if I put in 50% assistance right now, let's look at what the range of motion is. So this is half assistance, and we're already getting further extension than we were in the past couple of days.
Okay.
Right? So we're clearly having less tone here. That's sort of counteracting that. So
Okay.
we really need to capitalize on this and then set some of those values such that we're going to practice in those ranges of motion. So I think that's going to be a big thing for us. I'm actually going to sort of bias some things a little bit
Okay.
into higher extension values. So it's not like I don't want us to work in flexion, but I really want to spend more time, if at all possible, into extension.
Okay.
So
Yeah.
I'm actually going to shift the ranges of motion up, if that makes sense.
Yeah.
I'm
Sure.
going to kind of bias things up a little bit.
Okay. Sure.
But that will help us focus more on those values.
So focus more on extension compared to flexion. Okay. Yeah. Sounds good.
Exactly. Yep. Okay. So that's there. You guys can go ahead and hit the back button for me. Perfect. And then we'll go home and we'll make sure that the data has hit your prescription. And then we'll also make sure, yes, very good. And we'll make sure this actually works in terms of our, let's see here. So that'll be there. Okay. Good. Yeah, I'm reasonably happy about this.
Good job. Now push down for me. Push down, Daddy. Push down. Push down. Down.
Good.
I'll be about to find the blue one has to hit the bottom.
Yep.
But push down. Push the blue down. Let's get that shot probably too quick.
Good.
Up. Now push down. Daddy, push down. Look at the blue bar. You have to hit the bottom.
Good.
And push down, Daddy. Not with your neck, with your hand. Squeeze. Good job. Do you see? Do you see how you can do it? Good job. Dr. Housley, what is a good exercise for extension?
Yeah, this is interesting in terms of extension of the wrists, you mean?
Mm-hmm.
Okay. So there's a lot of things we can do. It depends on what we're trying to actually accomplish. If we're just trying to get range of motion, like to do some real good stretch, I really like weight bearing. Weight bearing is some good stuff. And weight bearing is interesting. It doesn't have to be like on all fours. It can be weight bearing against like a door jamb, for instance, right? Where you can kind of modify that. And you can kind of link together multiple things as well, right? You can try to link together balance and some extension exercises. So I will often put people in door jams where they're relatively stable, but you can work on weight bearing, try to get some lean into extension, that kind of thing. That can be very helpful. But if it comes to like active movements, which I very much encourage, one of the most important things I really like to do is to not have it just be purely trying to extend your wrist. I very much like it to be tied to something that is really motivating. Like for instance, for me, one of the most motivating things in the world would be being able to pick up a cup of coffee, right? So I would try to work on decomposing all of the tasks associated with trying to complete this one goal of being able to pick up a cup of coffee. And so I don't know what that task is for you guys, but I would find one singular thing that you could sort of focus on and try to identify, presumably it's an upper extremity task, and then sort of decompose all the elements of it And that way you're really goal oriented. It's not just I'm doing extension for extension's sake. I'm doing it with the express purpose of being able to do a given task.
Sure. Yeah, that makes
So if it was eating, for instance, right, working on that process of opening and closing your hand to get the actual aperture for the utensil, or being able to control it to try to extend your to feed yourself.
sure.
The other thing you can really work on is working on level surfaces where you're not only going to get extension, you're going to also work on coordinating multiple muscle groups. So you can kind of work on, if you have like a table that's relatively smooth, or you can reduce the friction by using like towels or these sort of things. You can work on trying to do reaching tasks on effectively where you're reducing the effect of gravity because the table is removing gravity. So you can kind of modify tasks that way. Similarly, you can also orient your joint segments to remove the effect of gravity, right? Because gravity is having an influence this way. And if your muscles are weaker and under normal circumstances, we're kind of operating like this, we can remove the effect of gravity by rotating the systems and having gravity not really influence this. And you can also make it easier on your shoulders and your elbows by putting your hand on a table as well, and work on, for instance, if I just imagine a table surface like this and I had my cup of coffee here, I could have my arm oriented vertically. I could try to slide my hand and I would be getting elbow extension and wrist extension, work on just that task of trying to just try to initiate the task. Yeah.
Yeah, got it. He has this thing, the Saber Flex. I mean, it's been a while because I'm just busy at work. His caregiver, a lot of times he tries to, for example, pick up balls from like a container and put on a table. And I think I should motivate him not to hold the hand with the right hand and do the task.
Yep.
Because it's a lot more harder for him to focus on grabbing, getting, and lifting. So he tries to use this hand to make it his life easier of not thinking about the other muscles that needs to go for reaching and then grabbing and then closing and then lifting up. So he will use this hand to kind of make the task a lot easier for himself. So maybe I can ask the caregiver to do less, maybe repetitions, if that's a lot more counts for him, and just do 5, but just tell him that you have to, for this 5, you have to go get the ball, pick it up, and put it on the table.
Yeah, I think that's a great suggestion.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.